Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Yarborough Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
To the second segment of Therapy Thursdays, we are Angela and Dr. Jerry Yarborough with Physical Therapy and Balance Centers. And we are talking about shoulder pain today. And I have personally experienced shoulder pain, and I didn't realize just how much it affects you. Like lifting my arm to brush my hair was a chore, and I never would have thought that shoulder pain would have been that difficult.
Yeah, it really can. And the shoulder is actually the most complex joint in our body and really the least stable. We have over 21 muscles that attach to our shoulder, and our shoulder girdle altogether has even many more. Our shoulder girdle is made up of our collarbone or clavicle, our scapula, which is the bone back here, and then our humerus, which is the arm bone. Now, the shoulder joint is a ball and socket joint like the hip. So it's got a socket like this. The hip does, it's nice and deep, and the ball sits deep inside of it. The shoulder, however, that socket is very shallow, and the ball sits right there, and the stability comes from all the muscles around it to hold it in place. And the scapula is just free floating on top of our ribs, and is only stabilized again through muscles. So again, the shoulder joint is very complex. There's many different things that can cause pain, but we're focusing on the most common causes of pain in this series. Last week we talked about shoulder impingements. Today we're going to be talking about rotator cuffs. And next week we're going to talk about osteoarthritis. Now remember, in the next segment we're going to talk about the causes of the pain, and we're going to talk about things that physical or occupational therapy can do to help you overcome that pain and impairment. And then lastly, as always, we leave you with at least 3 things that you can start doing immediately to help recover from your pain and get back to loving your life. That is our motto here at Physical. So come back in the next segment. Hey guys, welcome back. It's Dr. Jerry Yarborough at Physical Therapy and Balance Centers in Ruston, Jonesboro, and El Dorado, Arkansas. This is my sweet wife, Angela. She's going to be our demonstrator today. And in the previous segment, we were talking about rotator cuff injuries. Rotator cuff injuries are very common. So in physical therapy, we do specific tests to determine what is your cause of pain. Is it impingement? Is it rotator cuff? Is it arthritis? Is it frozen shoulder? Is it on and on and on? A lot of different things. Outside of an orthopedic surgeon, physical therapists are the most qualified to determine what your problem is. All right, so if you have pain more than just one or 2 days at the most, I highly recommend that you seek medical care. All right, as physical therapists in the state of Louisiana and Arkansas, you have direct access, which means all you have to do is pick up the phone and make an appointment. You do not have to have a referral, but we highly value the communication with your primary care providers. So as always, I want to give you a few things that you can start doing today to help improve the impairment that you may be having from a rotator cuff tear. You can use a towel or a stretching strap like this, okay? So this is gonna be her affected arm, and we're gonna work into external rotation first. So she's gonna reach back and grab that towel or the stretching strap and pull down, working into external rotation. Now remember, with all stretches, you should not be causing a lot of pain. All we want is a gentle stretch. You're gonna hold it for about 30 seconds and do that 3 times. Now, if her problem was internal rotation, she could use the same strap, and you're gonna use your good arm up there, and say you're stuck way down here, you're gonna pull that strap into internal rotation like this. You're gonna pull it until you get a moderate stretch, hold it for 30 seconds, do it 3 times, and then relax, okay? So another good exercise is to start strengthening all these muscles. Now the shoulder has 6 movements. It has external, internal rotation, forward flexion and extension, and then ab and adduction. So a safe exercise to do is what we call isometrics. You're getting a muscle contraction, so you're gonna work on strengthening, but you're not gonna have any movement, so it'll be least painful. You can get a towel, put it on a wall, and push your hand into that towel like that, okay? And then you move the towel back here and push your elbow back into the towel there. You turn and put the towel here and push that elbow into the towel like that. And then you can put the towel in between your elbow and your body and squeeze it. Now when you do these, I want you to do them for 10 seconds and try to do them 10 times. Now also you can put the towel here and push your hand into the towel, working on external rotation. You're gonna turn your body, put the towel here and work on internal rotation. Remember, you got 6 movements, okay? And you're gonna do each one for 10 seconds, 10 times, and that's working on strengthening. All right, guys, so if this doesn't help your impairment, please give us a call. We'd love to help you, and we'll see you guys next week when we're gonna be talking about osteoarthritis and how that causes you pain and impairments.